Yes, I remember it was 2002, and one day a man named Frank Fearon walked in my office, and he said, "I'm a doctor, and I want to use the skills that God has given me to come alongside those in need that are in the community." And a week or two later, two other people from Perimeter with health backgrounds said the same thing. And I said, God may be up to something here. As they researched around Atlanta, they discovered Good Samaritan Health Center in downtown Atlanta. And they asked them and said, "Hey, do you think we could start the Good Samaritan Health Center of Gwinnett?" And that's exactly what happened. And I don't think our initial founding board could ever have dreamed of what it has now become.
Because we are so much more than just a single appointment, we care about your whole family, we care about your living situation, your employability, your sustainability, and we try to address those things with our patients. I felt like we were not just making people healthy, but we were going to transform them in a way that they would be self-sufficient, competent, and capable in our community.
I mean, people come in here at such different stages in their lives, and some of those stages are very, very difficult. And our staff has just done a phenomenal job of just meeting people where they are. Whether you are a person who has never gone to a doctor's office before, or you have found yourself recently without insurance and don't know where to turn, we do definitely try to treat the whole person. All of the different aspects of our business when it comes to training and development and working with some of the local universities and colleges in helping that next generation of healthcare providers. Our work is all encompassing. It definitely fills my cup to know that we have impacted so many lives. And so I see us as not just a doctor's office, but an organization that plays a pivotal role in the community.
As someone that came in as a child as a refugee and has lived in this community, in this area in Gwinnett County for over 40 years, I am so grateful and thankful that we have Good Sam. It's enlightening to be able to give back to your community, especially those that need it the most. As the board chair, something that's very important to me and special to me is seeing all the employees that work here. They genuinely care for their patients. It is, to me, it's a mission for all the staff here that take it on them to really want to give back to the community in their professional way.
I'm incredibly grateful for my time at Good Samaritan. I started out as a student and did 2 rotations at Good Sam, and then came on as a volunteer provider, worked PRN, and then part-time came into a full-time role, and then moved into leadership about 8 or 9 years ago. And I have loved every minute of my time at Good Sam. Being able to care for the underinsured, the uninsured, and folks who need someone to stand in the gap for them has been one of the greatest privileges of my life. Access to healthcare is so vital for every person, and to see people access healthcare for the first time and to learn more about their ability to access healthcare is wildly exciting and empowering. And to see people's mindset shift, to see people's mental health improve because they're able to recognize that they are dignified, they're made in God's image, and they are worthy of care. And to see people step into that confidence is awesome.
What does transforming communities mean to me? It means transforming them from the inside out, starting with the heart. The heart of Christ, and that's central to everything that Good Samaritan does.
They care spiritually about a person getting to know and have a personal relationship with Jesus Christ, but they're also addressing real physical, mental, and emotional needs as well. And so they address what you would say is transformation in a person's life.
The nonprofit business is a very, very tough business to be in. and there's always a scramble for resources. But I think the fact that we have been here 20 years has shown that God has really had his hand on this ministry. I'm proud to be part of something that I think has lasting ability. You know, my hope for the next 20 years is that our footprint in the county can grow through training and development as well as healthcare, through the launch of Access Academy and just being able to reach more people and give them an opportunity to get that foothold into healthcare that they might not otherwise have.
And I also think we'll continue to be a beacon in the community. We're the busiest nonprofit health clinic. We're the largest nonprofit dental clinic in Gwinnett County. And we have many, many partners. And as the county continues to grow, more and more people will learn about us. And I'm excited about the possibility of adding additional clinics and staff and just growing the kingdom through the work that we do here.
Obviously, I'm hoping that that we would continue to serve the kingdom and serve it competently in the medical field, but to serve it more completely. We just hope to continue that, to do it in more places, and to sort of export our best practices, the things that we've learned over the last 20 years.
Good Sam in 20 years has worked really hard to help the community from having to go to the ER to really take care of the approach. If you don't have insurance and cannot find affordable health care or dental care, you can come to Good Sam and get that. Right now, we have 2 clinics in Gwinnett County, but people come from all over the state. So the opportunity to offer this in other clinics and grow it is incredible, and I can see that in the next 20 years.
I see Good Samaritan Health Center as one of our premier community outreach partners. We are so privileged, so thankful to have been part of the journey from the beginning. It's been a gift to us at Perimeter as well as Good Samaritan.
I'm so thankful to the board for their hard work to keep us up and running, and I'm thankful to the leadership of Greg Lang and Shamika Allen and all the folks that have made this possible. It's been amazing, and thanks to the donors who have showed up every day, every year when we have every need to make sure that our people know that they are loved and cared for and thought of, and looking forward to another good 20 years ahead.
And I believe that the legacy of the Good Samaritan Health Center is that we are an example of the living gospel. We're never going to be only a medical clinic. We're always going to be a church first and foremost.